Okay. As was noted, the title of my talk is Health and Healthcare as an Information Science. What's in it for you? And I know there's a lot of mix of people in the audience from different perspectives, and so I have something for all of you. I think the main thing is that the thing I really have for you is a challenge. Because I think the wonderful thing about informatics is that we're at a time when we really need to create the future. And I think that's really the most exciting dimension and message actually for the day. And I think as for the future, your task is not to foresee it, but to enable it. And I think that's our opportunity. It's a little early in the morning to have a should word and a slide, but I guess the thought that I have for you, at least as a personal view, what vision really should a society have for its people? And from my perspective, it would be healthy people living in an altruistic society. It's fascinating. Recent research is showing us that about half of all health status actually relates to social determinants. Meaningful work, shelter, education, a safe environment, and then half of it coming out of healthcare. And obviously, healthcare from the CHASM study report should be equitable, efficient, effective, patient and population centered, timely, and safe. Put in a sentence, I guess, we would like to have long and active lives with a quick and painless death. And how can we obviously do that? Now, how are we doing in this country relative to that? And we're probably really at a bottom point, I hope, in some respects, but these are tough days. Still rising unemployment, rising loss of homes, rising loss of insurance, rising numbers of poor children. Hopefully the recent legislation will help that issue. Rising imbalance among groups for key social goals, rising healthcare costs with an increasingly poor system performance when compared to other nations, and increasingly restrictive regulations with respect to access to personal health information, which has implications for research as well. So the challenge, I think, at the policy level as well as at the working level is how can we peg a health and altruistic version that creates a better balance among competing social goods. Freedom's important to us, altruism is important. We want healthy individuals, healthy communities. We do want personal privacy, we want personal autonomy, and clearly we want useful knowledge. And obviously, most of the times these things can work together, but at times they can be in competition. And I think that is where biomedical and health informatics also can come into play. This is my own definition of the field. It's a scientific field that draws upon the information sciences and related technology to enhance the use. It's action-oriented by its conception. Enhance the use of the knowledge base of the health sciences to improve health and healthcare, research, biomedical, clinical, public health, education, management, and policy. Well, this is fairly broad, but I think actually that is in fact the scope and scale to look at this. Now, how do we distinguish health information technology, health communications technology, and informatics from one another? I would say that we look to somewhat to get too simplistic. That information and communications technology is the sort of the hardware and software sort of nouns, where sort of the silicon and the fiber dominates the carbon side. Whereas informatics is how do you harness those to achieve desired ends. It's the verb, it's the action side, it's the use side. So informatics is the science of the use of information, and in that sense, so it's the human side, as you said, the comment about it as a behavioral science speaks to that it's really looking at the carbon side of this, but obviously how do you integrate with one another. And why is this important? Well, medicine, Cyril Chandler is a colleague from the UK, he said medicine used to be simple, ineffective, and relatively safe. Now it's complex, effective, and potentially dangerous. That changes the whole dynamic. If you're talking about healthcare, you can end up creating more harm than good. And of course, what is the challenge is that we have an information big bang. I used to use a metaphor of drinking out of a fire hose. Now it's sort of like a hydrant or the outlet from a dam as far as the information that's coming out. So the point is that where can you go for this if you're really kind of interested, at least in hoping to try to be part of the solution instead of part of the problem. And AMIA likes to feel like as a professional home for biomedical and health informaticians, at least you're with folks who are struggling and trying to manage to this in a sensible way. And by that I mean, how do we, in a sound way, apply health-oriented information and communication technology and relate to those related issues, whether they be policy, education, and so forth. So we like to see ourselves as leaders in the education, policy, and research fronts. The website is there. We also have American College of Medical Informatics, and the American College of Medical Informatics is an organization of essentially people who elect other people who are considered to be masters of informatics. And I think, so that's an elected honorific group, and AMIA helps administer the conferences. AMIA members, at the moment we have about 4,000 members, very international, 53 nations. We have members in 53 nations, and I think to some extent we're increasing actually our international activity. We just got a $1.2 million planning grant from the Gates Foundation to work with AMIA and colleagues to create a global network of informatics, particularly trying to help care and use information communication technology and informatics to improve the health status in developing economies. But anyway, if you can look at it, our historic base has been very heavily in clinical informatics across the health disciplines, particularly nursing, medicine, and such. But also clinical research informatics is increasingly becoming very much enhanced by the Clinical Translational Science Awards. That's really put, I think, in our academic environments, informatics more front and center. But besides that, in spite of that, I guess one might say, probably the fastest growing sector in AMIA is public health informatics and population informatics, which actually I'm very pleased about, although my tenure home at Wisconsin was, you'd think maybe in surgery, actually it was in preventive medicine. I had a 51% appointment in preventive medicine. And I think this is an exciting issue because the health of populations relates particularly to that social determinant side. And I think we've underdeveloped, if you will. It's a young field, it's understandable. But I think there's a lot of exciting work that will be coming forward in the population and public health informatics side of things. And then a new space, translational bioinformatics, about 10% of membership is there. And this, in some respects, is, again, an extremely exciting area. For centuries, we have looked at essentially organs and systems as the base of understanding health and disease. And I think translational bioinformatics is moving as more to a molecular model, to the molecular level. And again, that's part of the demand for knowledge and information and managing it. That's a challenge. When we look at our membership in terms of who's self-identified, clinicians are the largest group, and if I just could see hands, I guess you could click, but I'm just going to have you raise your hands if you're a clinician. So again, quite a few folks in the room are clinicians. IT professionals, though, are also members, administrators, managers, educators, researchers, a fair number of students. Some folks didn't identify themselves. They may have been in the non-PIT group. Consultants and librarians. We don't have a lot of non-PIT folks, so actually it's a fabulous group of people. As we think about our work and do it, we see really 4 to 5 major domains actually that we've strategically oriented our plan and thinking work. Applied clinical informatics, probably the most, as I said, a big area, and certainly with the ARRA or ERA legislation, this is a very exciting time for us, including at consumer health is a big space. Clinical research informatics, again, growing, relating to just research or trials, or even the methods used in translational bioinformatics. Public health, population informatics, translational bioinformatics, the research itself. And then a group that we've not specifically focused on, but I think actually we do need to, we do have members that are in this space, and I think as a surgeon, for example, a former surgeon, simulation is becoming very important, and it's also hugely important in education increasingly. So imaging and visualization and simulation is another space, but between all of those areas that pretty much covers the waterfront of activity. We like to see ourselves as amiable informaticians. I think that it is a happy tribe. We have a great time together, and I think through these things what we're really interested in doing is transforming things. And as I went back to that rather grim recitation of how we were doing, you can see that as a terrific opportunity we have to actually make an impact and carry forward this. And to do that, I think what we have recognized in the last few years is that we really need to transform informatics from what I would say is a serious avocation. People have been doing informatics for 30 years or so, to a formally recognized health profession. And so a set of slides will be talking about our activities on how we've done that. Now the thing that's interesting about informatics is that it draws on so many sciences and so many bases, biomedicine, behaviors, which relates also to values and standards, disruptive technologies, and clearly, obviously, that's as far as challenges to keep up with, one of the greatest ones. And then, of course, there's just a variety of things that you need to draw on to hold these things together. Before I speak to the professional activities, I do want to talk about the impact we're having, because I think the thing that's fascinating, I think informatics, these disciplines I was talking about, are reshaping the future. If you look at electronic health records and electronic health record systems, clearly they can show increasingly the capacity to transform healthcare services, and particularly care processes if it's done right, relating to things in industrial engineering and so forth. At the translational bioinformatics, I was talking just a moment ago about how we're shifting the focus from organs and systems to molecules. In the public health, population, consumer health area, again, whether you're talking about secure web portals, the kinds of things that John Lampka and his colleagues have led in trying to get the patient into the middle of their care. Probably, in my view, and AMIA's view, is one of the most exciting dimensions of patient-centered care is bringing the patient actually into their own activity and their own record. So I think also the health information policy space is very dynamic. We're excited that we have 5 members, AMIA members, on the new Health IT Advisory Board that will be helping on the new legislation. So if you look at how we see our task as professional informaticians and the vision of assuring an adequate workforce capacity going forward, what we really are wanting to do is integrate. Informatics should integrate. It should be multi-professional, multidisciplinary, and it should integrate activities. And so if you look at on the left side here, this components picture, you have the issue of policy and leadership at the top. You have the whole issue of the human capacity and capability in the middle there, the workforce capacity, and then of course you have the technology and the infrastructure at the base. And as Amy has talked about this and thought about it at the professional level, on the right hand, we're developing a set of initiatives that speak to those levels. Executive seminars and leadership training and advocacy for the policy and leadership. We will have a leadership seminar for Chief Medical Information Officers in October. Hasn't been announced yet publicly, but that's one. We're also talking about something for state leaders and public health leaders of a similar kind of executive seminars and leadership development. And then, of course, when you talk about those of us who see this as a professional career and the human capital, at the top of that are doctoral level, master's level, other professional informaticians. We, in fact, are creating a medical subspecialty in clinical informatics in medicine and are hoping to get funding. We're out seeking funding for an advanced interprofessional clinical informatics certification to be essentially a corollary to the physician subspecialty. The American Board of Preventive Medicine is who we're working with, but all of the boards but one of the entire 24 boards has expressed interest in being part of that. So whether you're an internist, pediatrician, surgeon, whatever, you would be able to get training in clinical informatics and be boarded as a clinician informatician in that area, and then of course obviously similarly in nursing and so forth. So at that level, if your career is really a trajectory to be a practicing clinical informatician, that'll be that professional model. We're also very interested in developing what we're calling clinical champions and public health champions. And our 10 by 10 program, if you haven't read about it yet or heard about it, I'd urge you to go to the website, AMIA website, and look at those programs. I'll talk a bit about it more in a moment. And then below that are just what we're calling some building blocks, some perfect vision, 2020 vision, little pieces of, if in fact a 10 by 10 course is sort of a protein, some of these building blocks would be peptides, about little pieces of knowledge and skills that would be helpful to somebody to add that to their repertoire of knowledge and skills. And then of course there are also kind of toolkits and other things that are needed, and we work collaboratively with other groups to do these things. So that's our vision of actually how we build out the workforce. So the point is, in making informatics this formally recognized profession, clearly you need this national infrastructure to support informatics, but also, as I say, you need this professional informatician model certification training to help people at all these various roles they're in, whether it's a clinical, public health, or research, or translational bioinformatics. Typically, the person that's doing translational bioinformatics usually is in an MD PhD program or a PhD program. But the point is, the others, I think, are more training and certification in the more traditional models. The 10 by 10 is something I just mentioned for the clinical champion, and it looks like from the evaluation data, we've trained about 1,000 of those people. We want to train 10,000 by 2010. We're ready to ramp up, and if in fact the stimulus package gives us enough stimulus, we think we can manage that. I'll talk a little bit about what we've put into the hopper, or thinking about that this afternoon. The HIBBS is the health informatics building blocks. You can never have enough acronyms, certainly if you live in Washington, it seems like. So these are training and short courses, mostly hopefully web-based, and then of course we do a lot of advocacy and public education. There's some of our luggage tags out there, got EHR. We put together a small half-hour program actually that went on television a few years ago, and 2 million people saw that across the land. And we've talked to Walmart recently as they're marketing the EHR for small practice settings, that in some communities they may in fact want to use that. It's still a timely slide. We've also started building a network of our national units, if you will. There have been 20 major programs across the country that the National Library of Medicine has funded over the years, and clearly those are probably our biggest, most distinguished units or education departments. But the Academic Forum, which we created 3 years ago, now has 45 educational departments and units, and they're looking at such issues as what are criteria for promotions and salary structure, and just how do you run this as actually a part of a university in an ongoing sort of way. We've also developed a group called the Academic Strategic Leadership Council, which is focused not at the department faculty level, but at the senior leadership level of the organization, vice presidents, presidents, provosts, and so forth, and try to create a more informed advocacy so that these people understand what is informatics as opposed to, for example, IT. Oftentimes the confusion is, well, that's just a computer and how to use it, and not really all the richness that we're talking about here. I think that's changing a lot, but the point is that's important. One of the most exciting initiatives that we're hoping again to get funding for is a way to get ahead of what I think will otherwise always be a challenge of remedial education by starting a common interprofessional informatics curriculum. for all entering health profession students. And this is something that actually the AAMC, the AACN, so the doctors, nurses, pharmacists, dentists, schools of public health, osteopathy, all professions that pretty much are talking about how can we get a core kind of curriculum for all entering health profession students that would look at the IOM 2003 core competencies of provide patient-centered care, work in interdisciplinary teams, employ evidence-based practice, apply quality improvement, and utilize informatics. So how would you utilize informatics to accomplish those objectives? And we've got a proposal hoping again to move forward. The idea is that this would be knowledge, skills, and attitudes at 3 levels. I'm aware of this, I've heard of that. Semantics and pragmatics, I understand that and I can do it. And the idea is these are the competency domains: communications, documentation, ethics, access and use of person-specific health information, information seeking and utilization, patient engagement, problem solving, systems approach to practice. So a very exciting idea, a really game changer, and I think that's something that we're hoping to engage very soon. The 10 by 10 program, Charlie Safran and Bill Hirsch were key in helping this get started. We now have 6 of those programs across the country. 1 in research informatics as well at the University of Cincinnati. We probably are likely to start a research forum, much like the academic forum, to help those places that are in particularly the CTSA initiatives, but others as well, to really build out the research informatics side. And we have Stanford's translational bioinformatics. Nursing informatics and public health informatics have recently been added. We're expecting one in consumer personal health informatics soon. This has been translated, Bill Hirsch's course, into Spanish, and over 600 people have been trained in Argentina as well. So this is also going global. We also at the moment have another program in Singapore that's tied to this. So we now have an I-10 by 10, an international component more formally developing. We're also developing some of these HIBBS, these HIBBS building blocks at the international level, and have received support from Rockefeller and are back into talking to them. In the interest of time, I won't more into that, but an example, what would one of these building blocks look like? For the past 3 years, we worked with an organization called CS Placement. It's a not-for-profit organization that was, prior to that, had the name of the International Computer Driver's License US. I don't know if you're familiar with the International Computer Driver's License, but about 9 million people worldwide have been trained how to use computers through a set of courses. The Finns years ago concluded that if they were, at that time with Nokia and such, they were really into communications technology, and they figured, well, if you can teach people to drive a car and give them a license, we can teach them to drive a computer and give them a license. And so there had not been a health dimension of this. So I'd worked on this when I was in Cambridge in England, but when I got back, we started then, what would a course look like for anybody who's going to touch a keyboard that has person-specific health information on it? What do they need to know? What are policy, procedures, and what's the law of the land? So we've developed that for this nation, and this is now out and available. It's called the DPRC, and essentially we've also developed a little learning guide for this. And so this is a nice little building block. You do need to know something about privacy, security, confidentiality, and what the law of the land is. If you can pass this exam, it's a pretty validated exam. You may not behave right, but you should know how to do it and what's needed. So our mission is to then create health communications and information technology and systems to transform healthcare and measurably improve health status. The measurably improve is a pretty serious comment. Strengthening the ability to create and manage the knowledge base, and then actively participate in the global information policy, technology, and such dimensions. So very robust kind of agenda, but I think we're wanting to essentially do good, do it well, and with others help shape a health. Excellent board of directors, and I think they represent people across these areas. excellent staff. Rob Rader's here. Rob, where's there in the back? He'll be in the hall later if you have a chance to meet and talk with him. I think the point is we have a lot of colleagues who to see you join the ranks if you're not currently a member. There's a lot of opportunities you can see to fit in and have a good time. So whether it's these activities or programs, either taking them or teaching them or being involved, I'd love to see you. So the fact is, we see almost an infinite opportunity of areas where one can participate, whether it's education, whether it's at the infrastructure level, whether it's research or policy. I think we need, and I think we can have a lot of both enjoyment as well as satisfaction working together. Our next meeting coming up is the May 28-30 meeting in Orlando, and then of course our big annual meeting is in November, and it'll be in San Francisco this year. They're redoing the Hilton in Washington. That's where we normally would have our fall meeting, just down the road. So you have to head west if you go this year. But at any rate, I think that is really a quick summary of a lot, and I'll be here through the whole day. Be happy to have conversations, side conversations with you as well. I really, again, thank you for the honor and the privilege of having time with you this morning and kicking off what I know is going to be an exciting day with a lot of not old colleagues I've known a long time, as well as obviously making some new friends. So thank you very much. Appreciate it.